You are welcome to my channel. Thanks for visiting. Today, I'll be addressing mononucleosis or kissing disease or glandular disease, but specifically contact sports restrictions or not. And why that? Teenagers and young adults will suffer most when it comes to mono, but they are the ones also that will be involved in contact sports the most. Why should they not? And when can they return to contact sports? Without further ado, let's go. We will take history, but I won't waste your time to go through that lengthy process right now. So if you want to know more, please click on this very link. That will take you to everything on infectious mononucleosis. Within the first 30 days of onset of mono, we don't expect you to be involved in contact sports. We'll do physical examination and have ultrasound to determine when you can return. Why do we say no contact sports? The reason is your splenic size, the size of the spleen would determine. If the spleen is enlarged, no contact sports. If you have fatigue and is troubling, no contact sports. If you are within the first 30 days of the onset of mono, no contact sports. If you have not been cleared that you cannot run into the problem of splenic rupture, no contact sport. How will you know that the spleen has been ruptured? If you go behind your physician to engage in contact sports when you have mono, you are going to feel sudden and sharp abdominal pain at left upper corner. You may feel dizzy, your heart may be racing depending on how far you've lost blood. When you get to your physician, he or she is likely going to pick guarding and tenderness. The BP may drop, giving us hypotension, and the heart rate may shoot up, depending on where we are when it comes to the effect of the rupture. You may lose consciousness, and if appropriate intervention is not instituted quickly enough, young lady, young man, you may kick the bucket. Now, when can you return to contact sports? When you have been cleared that your spleen is no longer enlarged, as no longer posing any trouble if you hit someone or they hit you or they kick you. Once you have been cleared that there's no splenic enlargement, even if it is not mono, if you have splenic enlargement, no doctor will clear you to go and be playing hockey, okay? No more fatigue and other troubling symptoms. If that is the case, you can be cleared to return. If you have gone beyond 1 month after the onset of mono, your doctor can tell you you can go back if the fatigue and other symptoms are no longer troubling, if your spleen is no longer posing trouble, it's not so much enlarged. It is better that we stay or wait for 2 months after the onset of mono to be pretty sure, and also ruling out the splenic enlargement and troubling symptoms. Now, the conclusion is that everything in medical practice is meant to save lives. I have decided to publish this presentation because majority of the people in the world would have come across mono in their lifetime, and they may not even know. But those who will suffer the most, the group will be adolescent and young adults. They are the same people that will likely be involved in contact sports, and that group may likely go behind their physicians to be playing all those sports. But when you are diagnosed with mono, please give yourself that break. Take that break of the contact sport. Thanks for listening. Please remember to share this and remember to subscribe to my channel. I appreciate it.